Good morning, everyone. Thank you for making time to attend today's town hall on Thursday, September the 3rd. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Happy to once again moderate today's town hall. As a matter of housekeeping, just to let you know, we'll have some time for questions. We have some presenters. I'm joined by several of the members of the senior leadership team. We'll have some specific remarks from a few of them, and then we'll have a chance for questions and celebrations. On the questions and celebrations component, you can use the Q&A function at the bottom in Zoom. You can also raise your hand as a participant to ask a question directly, and we will call on you in the order that those questions are received. As always, if something that comes to you later and you want to ask it later, you can always email that question to HHS at hhsnews.ca, and we'll do our best to get you an answer. We've also got a few questions from that forum that we'll address proactively in today's session. So that's enough for me. I'm going to hand it over to Rob MacIsaac, our President and CEO, to kick off the agenda today. So Rob, over to you.
Okay, thanks very much, Aaron. Good morning, everybody. And as always, thanks so much for tuning into these town halls. Fall is just about here, and it's always a busy time at Hamilton Health Sciences as people return from vacation and things begin to gather steam again. Also, on a personal level, for lots of people here at Hamilton Health Sciences, it means it's a time members of your family are headed back to school. Today, Dave McKeag will provide an update on back to school support available for Hamilton Health Sciences employees who may need to be absent as kids transition back to school. We're also going to hear from Dr. Dominic Mertz on the status of COVID in our community. But to begin, I'd like to speak a little bit about a really important topic that's been top of mind for me and for many others at Hamilton Health Sciences. And I think for anybody who's watching what's happening across the planet right now, the world feels like a pretty stormy place. And a lot of that for sure is being driven by the pandemic, but we've also witnessed an incredible shift in the conversation surrounding systemic racism and anti-racism. Hamilton Health Sciences has always been and will continue to be an organization that condemns racism in every form. That said, we know and we've heard from many of you that there are many things we can do to create a more inclusive, equitable, and diverse community for everybody who walks through our doors, be it patients or staff or families, etc. In response to your feedback, I've called for the creation of an equity, diversity, and inclusion task force to understand and bring forward recommendations on how we can strengthen our culture of equity, diversity, and inclusion at Hamilton Health Sciences. I've asked Dr. Sanjay Sharma of Hamilton Health Sciences neurosurgery team and Bruce Squires, the Vice President of Women's and Children's Health, to lead this work. And in the coming weeks, you'll see an invitation to submit expressions of interest to join the EDI task force. So I would encourage you to consider this important opportunity. In the meantime, if there's something you'd like to share with our Human Rights and Inclusion team, please feel free to contact them at inclusion@hhsc.ca. Maybe I could just spend a couple of more minutes talking about how our community and region is planning and preparing for this fall and for the possibility that we could see a rise in COVID infections or even a second wave of COVID in our community. This is work that's been occupying a great deal of my time over the past 8 months. So locally, we're working with our partners at St. Joe's, but also with many others, including the Ministry of Health, to develop plans for the city. That includes the establishment of what the ministry would call an alternative health facility in a local hotel space, which we'll use to provide care for non-acute patients who are waiting for a bed in an alternate setting in the community. This strategy will help us create more capacity in our hospitals for acute care and for trying to address the backlog of patients created by the early response to the pandemic. As you might be aware, the provincial government has mandated hospitals to maintain 10% surge capacity as a COVID preparedness measure. That puts a lot of pressure on all of the other services in our hospital in terms of their ability to meet the community's needs. I mean, we generally run very hot as a hospital, much closer to 100% than 90%. COVID aside, we're starting to see our occupancy rates increase again towards pre-COVID levels. So this alternate health facility will provide some relief in this regard, in addition to other strategies we're pursuing to keep our occupancy rates at a manageable level as we move into the flu season. We've got a lot of people from across HHS working hard to make this health facility a reality. I want to just shout out to all of them and say thank you for applying all of their energy and their expertise for making this a reality. Regionally, hospital leaders continue to work together to ensure a stable health system throughout the pandemic, and particularly during times when there might be a surge in cases of COVID-19. So all of the hospital CEOs in HNHBB meet on a regular basis. And the work we're doing includes monitoring availability and procurement of supplies and equipment, developing best practices for COVID-19 care based on advice from subject matter experts, monitoring capacity for surgeries and procedures, developing a flexible, scalable approach to potential future COVID care needs. We have designated hospitals across the region for accepting COVID patients, and we have regional surge capacity so that if one community runs out of capacity, they know exactly how their neighboring communities are going to pitch in and help them to get through it. So I'll continue to share updates as this planning continues, but I think it's fair to say, there's been a real spirit of cooperation across many different health service providers, both locally here in Hamilton, but across the broader region. And it's been very heartening to see everybody come together in the manner in which they have. So all of that said, I'd like to now turn it over to Dr. Mertz, who will be followed by Dave McCaig for their updates. And as always, afterwards, we'll have some time for questions, and would encourage subsequent to that people to recognize their colleagues for work that's going on here in the organization. So Dr. Mertz, over to you.
Thanks, Rob. I will start off just to give you a quick heads up on what changed. In fact, not a lot in terms of epidemiology in Canada over the last couple of weeks. And then go through some school scenarios that we may be facing, or parents of school kids will be facing over the months to come, and what it means in terms of your ability to come to work. Let's start off with the national view on COVID-19 cases. Here, Quebec, 62,000, Ontario second with 42,000 cases. On the right-hand side, you see a table with the weekly cases per 100,000, and you see that Ontario sits still relatively stable at around 5 to 6 cases per 100,000 per week, Alberta currently in the lead with 20, and it's mostly cases in Edmonton, but more recently Calgary as well. Manitoba also seeing a 3 times higher rate than us with 16.1 there. Next slide, please. This is our epi curve in Ontario, and you can see again the well-known peak, end of March, beginning of April, and then a relatively stable situation for several weeks now. What I would like to highlight on this are the color codes, and in particular the brown part of those columns, which is cases where there's no known epi-link, and you can see at the provincial level that's roughly 1/3 of cases. And these are the concerning cases in terms of these are transmissions to people where the index case remains unclear. So it's suggestive that there's certainly more COVID in the community that we are aware. All of this being said, things are relatively stable and much, much better certainly than a couple of months ago from an Ontario perspective. Now let's move on to Hamilton on the next slide, where we've been relatively stable since mid-April, I would say. I added the red lines here, which are like manual regression lines, which are parallel to each other. So that basically means in each of those time periods that are highlighted and have that red line, we see on average the same number of new cases per day, roughly 3 to 4 cases every single day. We've been in that stage before Roslyn. We've been in that stage before we finally moved into stage 3. Then we had a time period when we entered stage 3 where we are sitting at only 1 to 2 cases per day. And then currently we are again in a very similar situation as we had been before stage 2 and before the Roslyn outbreak. So let's move on to schools and scenarios you may get exposed to once the schools have reopened. And I will go through these scenarios to give you an idea of how these scenarios will be managed by public health, but also by our occupational health services in terms of under which circumstances you are allowed and welcome to come to work, and under which circumstances for safety reasons we have to ask you to stay home. There's of course a second layer to that, which is the need for childcare at home, and I understand that Dave will comment on those aspects as well. This is purely COVID related risks here. So the first scenario is your child is symptomatic, requires testing, but doesn't have an exposure or wasn't exposed to an outbreak. The kid, and these are the icons here, needs an NPS test, has to stay home until the test is reported negative. Our staff can come to work because the risk here is relatively low that the child has COVID. If the child is exposed to a single COVID case in the same classroom, but it is asymptomatic, in most cases, public health will likely send the entire class home. So that means that your child will be at home for typically 14 days, and most likely there will be a recommendation to get your child tested around day 5 to 7. For you, as long as your child is asymptomatic, you're expected to come to work. If your child is symptomatic, and that's the third scenario here, again, the child needs to get tested immediately, then has to stay home. If the test is negative, the scenario above applies. And the same for you as a worker. If your child has been exposed and is symptomatic, you will be in self-isolation as well until the test comes back negative, which means you wouldn't come to work. On the next slide, we have the situation where there's an actual outbreak in the classroom, and an outbreak would be defined by having at least one suspected transmission in the classroom, which certainly increases the risk for your child. If your child is asymptomatic, again, most likely the classroom or the entire class will be sent home, your child will get a recommendation likely to get tested around day 5 to 7, maybe earlier than that. This is still to be decided, but that's public health decision, not ours. As a staff, you may or may not be allowed to work. That really depends on the situation and the public health advice based on the risk of a given outbreak and whether parents and siblings are considered high risk and as such are self-isolated or not. So either scenario may apply here for staff. Once your child is symptomatic, again, you as a parent would be required to stay home at least until the child is tested negative. If there's a school-wide outbreak but not affecting the classroom of your child, a similar scenario applies as if there was no outbreak at all. So your child may have to isolate for up to 14 days. Again, that depends on the extent of the outbreak at the school. It's well possible that one of the other class that doesn't have any cases will be allowed to come back even during the time period of the outbreak. And as an employee, you can come to work unless your child is symptomatic. With this being said, if your child is symptomatic, again, you would stay home until that test comes back negative, which is when you would be allowed to come back to work. Now, this is what we agreed upon at this point of time with Hamilton Public Health. If you reside outside of Hamilton and another public health unit is responsible for you and the school your child is going to, their recommendation may differ from this, but at least at this point of time, for people residing in Hamilton, this will be the approach, at least now that when we are starting back to school, but things may change again. Okay, thank you. Back to Aaron. You're mute, Aaron.
Well, you guys just missed a really funny joke. No, I said, following this as a parent myself, that's a very helpful breakdown. We just saw a question pop up about whether or not this would be posted to the hub. It sounds like a great idea. So Dominic, maybe you and I can connect about that afterwards. I want to call on Dave McCaig next, our EVP Corporate Affairs and Chief Financial Officer. Dave, I know you and our VP Human Resources, Michelle LaRue, and her and the entire team have been thinking about the back to school, the implications for staff of all of this. If you wouldn't mind walking us through a little bit on that topic as the next step in our agenda, please.
Yeah, thanks, Aaron. For sure, a bit of a stressful time for parents and caregivers. We understand that you're facing a lot of challenges and decisions preparing to have your kids go back to school and what that all means. And even Dominic's discussion we just had can show the complexity of trying to navigate all this. So there is information and support available already on the hub that may help you work through what would need to happen or what it would look like if you needed to be absent from work. I guess that's a little bit more what this discussion is about, is what happens if you need to be absent from work. I do want to underscore that our primary goal, of course, in all of this is to reduce the spread of COVID-19 and to ensure we maintain an active workforce so that we can deliver patient care. So in that context, the next steps that you would need to look at, first of all, I would suggest go to the hub and take a look at the materials. There is information that was sent to leaders as well, and it is posted on the hub. One of the things, it's not quite as complicated as the one Dominic just showed, and we'll make sure everything is in sync as this information changes, if it does. But there is a visual decision tree which shows you what to do if. So if there is someone who is, same thing, if there is a decision where your class is an outbreak, or if a child has had a known contact with a COVID positive classmate, what happens and what do you need to do? I would suggest that you go through that. The first thing I would like to remind you is, everybody, you always have the resource of calling Employee Health Services, and they can help walk you through any situations or give you advice that will be very crisp, I am sure, for each individual situation. The second thing I would say is always go to your leader. Your leader can be helpful. And that will become even more important as you're talking about scenarios of, well, what if I can't be at work because of one of these situations? And Hamilton Health Sciences, we will try to be as flexible as possible, again, within the context of we need to be able to deliver care for our patients. So the ability to change shifts or flex if we can, or what have you, all of those things would be on the table, but again, in the context of individual leaders. I would say too, then you would need to start to avail yourselves of lieu time, vacation
Hey, we
time,
just launched our
those
back
types
to
of
school
things.
website, so I'll send you the link. Go see it.
I think you might be off mute. There we go. Thank you, Bruce. So I guess the bottom line is it will be complex. Everyone will need to be individually diligent all the time. It's going to be a bit of a stressful time. Again, we understand that for parents and caregivers. Your leaders are a resource. Employee health is a resource. The hub will have resources. There's also an FAQ that might help in terms of a specific situation you find yourself in. So I guess with that, I'll pause there, Aaron, and turn it back to you.
Thanks a lot, Dave. That's we had a couple of questions ahead of time, but I think you've covered them off about the kinds of supports that individuals could avail themselves of as they kind of navigate this situation with their families. So thanks for that. Dominic, I guess in the chat box it was raised about whether, what other options are there if someone doesn't feel comfortable bringing a child for a nasal swab? Can you give some advice on that and what the approach should be, what the thinking is?
Yeah, it's a quite complex question because it depends on into what of all of those scenarios this situation would fall into. I would say the knee-jerk reaction by public health would be 14 days at home for the child, and then it really depends on what the probability of that child would be to have COVID in terms of whether you as the parent are allowed to come back to work. All of this being said, a single NPS isn't as traumatic as some people may feel. I had a couple of my kids tested for a study as well, and they didn't complain a lot. So I would really want to emphasize the need for testing. If you're symptomatic, get tested. If your child is symptomatic, get tested. It's the best tool that we have in our box to contain COVID-19.
And then as it relates to the sort of the decision tree that you put up for those that might not live in Hamilton, be subject to the Hamilton public health decisions, how would they view that chart? Is that something that would still, I think they'd still receive directions from their local public health unit in any event, correct?
Yeah, in the end of the day, the local public health unit's decision will prevail, right? So we cannot provide any guarantee at all that exactly what I showed will be used by any of the other public health units. We will send it out to the other public health units, and our public health unit is working with several other units across Ontario West, trying to align their interpretation of the guidance document that they received. But it's very likely that public health units that may have another level of risk aversion may be more aggressive in their response to cases in schools than ours in Hamilton will be. So we need to see and learn, but it's well possible that there will not be a uniform approach across all public health units, unfortunately.
And I know a question that's come up in our household is our daughter's returning to school, and we're thinking about the exposures that we might present to the older adults in our family, one of whom we care for quite frequently. What would be your advice to families thinking that situation through? What should be top of mind thinking about as kids return to school? Should we be limiting exposures with others who might be at a higher risk should they get COVID?
I think that's a very individual decision to some extent. How important is it, for example, for the grandparents to see their grandchildren, whether they are willing to take a certain increase in risk by seeing them versus preferring not to see them and stay as safe from COVID as possible? And I keep saying there's nothing that's zero risk out there, and it's always that balancing of what's more important to you in a certain situation. All of this being said, to me, the single most important factor in all those decisions is how does the local epidemiology look like? As long as it's on a slow burn as it currently is and had been for most of the time in Hamilton, the risk is very small that something is going to happen, but it's certainly not zero. When you are in a peak situation like in the Sun Belt in the US, very different situation, and I would be probably much more careful exposing my parents to my children who are going to school than if it was here.
And as we move forward, another question here in the question box is, do you ever envision a situation where the 2-week quarantine might be revisited, potentially reduced, or any thoughts on that?
There's no signals at this point that that's going to happen. As you probably know, the US is at 10 days. Several European countries are at 10 days as well. So it may change at some point. On the other hand, there's also people arguing, and I got the question this morning at Ground Rounds, that apparently the European CDC is suggesting to extend beyond 14 days, because with every arbitrary threshold that you put, there's always the odd case that's later than those 10 or 14 days. And then again, it's a question of balancing how many do you want to cover, 99.9%, 99%, or 95% of your still infectious people with your arbitrary threshold. I don't see any signals at this point that we will change from 14 days anytime soon, but things may change, that's for sure.
And to close out the lightning round with Dr. Mertz, maybe one last question, Dominic, and others may wish to weigh in too. I know this traverses a couple of boundaries, but what about the COVID app, the federal app? Should staff be downloading that and paying attention to its signals? Was it, how does this tool differ from a sort of general public perspective versus a healthcare worker perspective? Do you have any insights on that?
Very good question. We discussed the implications this week at our subject matter expert meeting. The challenge that we have is the current app in its current version doesn't allow you to easily turn it off. You can turn off your Bluetooth, then you're not being tracked during your time at work. So that's certainly an option, but you need to remember to turn it off and turn it back on. And if you have, for example, an Apple Watch, which was mentioned as a concern, then you want your Bluetooth on, etc., etc. Rumors are that there will be a new version where you can transiently turn it off. The challenge is that the way the app communicates with you, you only get a report that within the last 14 days you may have had an exposure. It doesn't tell you when or where, and that's for privacy reasons. But that makes it very challenging. So if you're working in an ED and may have seen a COVID patient and were within those 2 meters for 15 minutes or more, you may get pinged at some point as soon as that person would put in the code that they tested positive, and then you get pinged for an exposure, which wasn't really an exposure because you were wearing appropriate PPE. And that makes it very challenging for our healthcare providers. So our approach or our recommendation to the corporation was that if you're working in settings where you can more or less frequently happen to be exposed to a COVID-19 positive individual while wearing full PPE, that doesn't mean that you're not allowed to come to work. You may or may not get tested depending on how sure you are that you've seen a COVID patient during that time period and that you haven't had any other significant contacts. If you're working, say, on a rehab unit, I think your behavior shouldn't be any different from someone out in the community, because you will not have a COVID-19 patient that you care about. Otherwise, you would know about that. So it really depends on the setting, but it's a challenge currently, and we hope that we will have that button at some point when you can turn it off, and then you can better rely on the app than you currently can as a healthcare worker if you are frontline staff.
Thanks for that. Dave, maybe I can pose, I did get a couple of further HR related questions ahead of the session today. Maybe I'd call on you One of them is around the fact that over the course of the pandemic, look, some people didn't take vacation because they couldn't go anywhere. Maybe they were working an abundant number of shifts. What can people, will they be able to carry that forward? Will we be able to use that in years forward? What's the thinking right now?
Yeah, thanks, Aaron. Yeah, so the thinking is a couple of things. First of all, each of our different employee groups, different unions or non-union, do have some different sort of standards of how much vacation can be rolled over. We are working towards just finalizing and hopefully communicating next week that we want to make sure that we at least bring everybody up to the same standard, the same amount, which would be 75 hours or 10 days worth of vacation that could be carried over. And again, if there's any specific individual situations that occur, always avail yourself of talking with your leader. But in terms of some of the groups that have less than 75 today, we are looking to try to communicate that, yeah, it's okay, because we want to recognize that that's the reality of our situation and do as much as we can.
And if you have to take time off for, your kid gets sent home, they've been exposed, what's the rules? Just a question here in the box about the rules of the road for, will you get paid for that time off? Is that sick time? Some part-time staff have no sick benefits. How can we find out more about that?
Yeah, so there have been other communications around that, Aaron. It is that one is a challenging point. During the initial wave 1 responses, there were some different measures put in place about being paid to be at home and self-isolating, etc. But the government and Ontario Health has since given direction, which we and other hospitals follow, which is a return to normal sick time practices. So that is a bit of a challenge in this situation, but it's sort of the reality as well as we try to maintain a workforce. So if your child is homesick, you are not able to use your own sick time to be at home. You would need to avail yourself of other measures of time that's applicable, whether that would be lieu time, vacation time, etc., or flexing your work arrangement, changing shifts, or ultimately an unpaid leave. So again, if there are individual situations, I would always encourage that discussion with the leader, but there is a framework that we are required to follow.
And I guess that speaks to the importance, we're always keeping government in the loop on how our workforce is impacted by the pandemic and the measures, but even for every individual, circumstances are so different. Do consider writing your MPP or even elected official of any stripe, just to keep it top of mind for them, how individual people are being impacted throughout the pandemic. I got another question here related to COVID, but the issue of screening. So those redeployed to screeners and how those hours would be applied to union seniority. Like as I'm redeployed to that role, would those hours count towards seniority?
So I'm gonna give a qualified or an unqualified opinion. I would believe so, but I would encourage that staff member to check in with their HR business partner. But hours that were recorded in the system, if you were redeployed, you're still your home position is who you are and what you were paid for. So I don't think there would be any implication there, but I wouldn't want to send anyone down the wrong message. So just encourage that you double check with your HR business partner.
Wonderful, thanks for that. So I'm going to go to, I have a couple of other topics, a couple of other questions that were raised ahead of time. Specifically, if I might, I think maybe this is a good one for Kelly Campbell. Kelly's with us today, I believe, around security. And we've been reading in the news, and as I've gone to our different sites, either the General or King West in particular, you can see the tent cities or occupations that are occurring in Hamilton. And the question is really about security and what are we doing in our own parking lots and spaces around this matter, perhaps others. I mean, I would presume our security practices still remain intact, but perhaps maybe we're being a little bit more vigilant. Kelly, could you comment a bit about that?
Yeah, absolutely. And James has put up the slide that really says, here's some of the things that we've put in place and have been in place for some time. Particularly at the General site, we certainly have new security concerns with Tent City, but we've always had security concerns at the site. So many programs have been in place for a long time. We have been communicating to staff of the site. We are, as concerned as staff are. The tent city is not on HHS property, so we're somewhat limited in what we can do, but we work very closely with Hamilton Police. We have certainly done active patrols and continue to do those on a regular basis in the parking areas, day and night. We continue to engage with Hamilton Police. We want staff to feel safe, and so the Walk Safe program, the emergency help stations, use of the buddy system are all ways that staff can assure they are safe going out to the lots. And we really encourage staff to report incidents because that helps us and helps the police really manage the situation a little better.
Thanks for that. Maybe while I've got you on camera and unmuted too, there's another question. I know maybe you might be able to give us a good answer, and I know Leslie Gauthier wasn't able to make this particular session today, but in DI, where we're ramping up, can you talk about the cleaning processes where now we're getting back to full capacity in those spaces? As we're putting through more people, are we concurrently enhancing our cleaning policies in relation to that?
Yeah, so as you mentioned, Aaron, I'm speaking on behalf of DI. I don't manage the program myself, but my understanding, first of all, there's really a need to get back to 100% capacity. We know that we had patients during COVID that didn't seek care, so we're seeing more referrals. We know that often a diagnostic test is really key to a patient's diagnosis, so it's really important that we get that activity back up and running. The interesting thing about DI is they've always sort of operated in a universal precautions environment, even pre-COVID, and the cleaning they were doing in between patients continues today. I think a little more time had maybe been allotted to it at the beginning of COVID, but now working with infection control, with universal masking, with patients being screened at the door, they are able to move back to what they had been doing previously, and that's perfectly appropriate.
Thanks for that, appreciate it. Dave, maybe just this probably back to you on in the Q&A box here. Can you maybe speak to the issue of T2200s around expenses that perhaps some have incurred working from home? Is that is that something that's being considered within the context of our return to the workplace planning? Can you talk a bit about that? Do we have a policy today?
Thanks, Aaron. Yeah, and we would have talked about this at the last town hall, but I'm sure lots of questions will keep coming forward on this. So at this point in time, for staff that were able to work from home and we have not, done a sort of an en masse return to work, we are looking at our approach right now as an organization. And by the way, it's quite similar with other hospitals, both on a short and a longer term basis. The short term is let's get through wave 2, such as wave 2 might be, and understand what that looks like and what the possibilities are, how that all plays out, when we can start to get people back. We kind of dealt with it very much in a on the fly basis, and in terms of equipment that people have and things like that. So longer term, we may need to put in more of an approach that acknowledges working from home as more of a permanent or at least a semi-permanent situation, and ensure that our staff have the right equipment and those types of things, which may or may not at the end of the day include the ability to have T2200s, which would allow you to claim some of your home use for tax purposes. So given that wasn't part of the employment agreement or the expectation, and it was certainly a reaction to a specific situation, probably not for this fiscal year, but it's on the table for discussion in terms of any kind of longer term approach.
Perfect. Maybe here, there is a question here. I'm not sure I understand the question entirely about creating shifts for individuals working Monday to Friday. Would it be under consideration to include a weekend or weeknight shift? I'm not sure, Dave, if you can interpret that one. Maybe to the person that's asking that question, if you want to clarify in more detail in the Q&A box, we can try that one again. With a little more detail. What do you think?
Well, I suspect the question is basically saying, can we be more flexible with our shifts if I have to deal with situations at home or what have you? And that would have to be up to the individual leaders trying to maintain a particular department's effectiveness. So if a shift could be worked on a different or alternate time and not affect the, what we need to do, then perhaps that is possible, but that would be very, very difficult to answer on an overall basis. So again, in those types of situations, start with your leader, and the leaders also know that they have the opportunities to avail themselves of either employee health services or their HR business partners to try to navigate situations. I know everybody is trying to care for each other in this situation and do the best that we can, and there will always be unique situations. So.
Similar feedback for the individual asking about one option says can apply for IDEL. Link was included, however, when it's open, the IDEL. Not apparent to me what that question is asking, but we'll try to get you an answer after the fact, or if you wanted to clarify. Oh, I see the person perhaps raising their hand. Okay, anyways, if you want to ask that live and clarify, that'd be great. If not, maybe just send us another note, or we'll try and follow up by email. I wanted to ask a question for Michelle Leaflor, who's here today, just around the HIS recruitment. Michelle, I know we had an overwhelming number of applicants for the roles that have been recently listed in relation to that project. Can you tell us when those that applied might get a heads up, or what the next step is?
Certainly, Aaron. Yeah, we are more than thrilled with the excitement and the number of applicants that are potentially going to participate in this wonderful opportunity. To the question, the formal offers will be September 21st. We do hope to give conditional offers on September 14th at the same time that we let managers know. And that will be conditional on the reference completions that will occur during September 14th to the 21st. So conditional on the 14th and final on the 21st of September.
Awesome. Thank you for that. Just a point made here about the tent cities being the individuals in those cities being far more likely to be harmed by others than harming anyone else. I think it's a good point. Just want to reiterate that for the benefit of the audience, in case you missed it in the comments. Certainly I was being faithful to the question asked, but absolutely agree with the sentiment that doesn't necessarily pose risk, but the question being asked was if one considered it that way, what are we doing as an organization? But a great point for raising that. Do see here someone with their hand raised. Look at this. Let's go over here. I have Krinizic, but I'm going to unmute you now and you can ask your question. No, nothing. Okay. Is often the case. I get so excited, but sometimes I know, audience, you hit that button accidentally. But that's okay. It is a great moment for me in this moderation to hear a live voice. I'll say now, as we're getting close to the end of our questions, do start to consider your celebrations and maybe making a celebration shout out live. That would be wonderful. I see from Susan Anderson here, infection, disease, leave. So that clarifies your question. Thank you for that. Maybe we'll get an answer to that after the fact. I'm still not quite sure who to pose that to. Will there be more postings coming out for the EPIC initiative? Michelle, maybe you can tell us about that. Is this just the first tranche with a project this big? We'll probably have other roles, won't we?
Definitely, Aaron. This is the first tranche to secure the main core project team, but there will be other roles in the future around training and other super opportunities that we will work through over the next year.
Great. And are those that have applied, they can expect, is there an interview process? Just to be clear, it's not just a straight up offer. We're going to do interviews and do some screening too, right?
Absolutely. We're screening. We have an EPIC assessment that occurs, plus interviews, and all of that is part of the mix for selection. Okay,
great. Okay, so I don't see any new questions being generated here. We do know that we have something. Well, I do recognize the IDEL question, which we will get an answer to after the fact. We'll do maybe one last call out, hoping for a live question. Going once. You can type one in too. Going twice. All right, well, let's move on to celebrations then. Thanks for everyone for asking questions, and for those that submitted some ahead of time. Always very helpful. And remember, you can always email a question to the HHS News inbox, and we'll do our best to get you an answer or punt it forward to the next webinar so everyone can hear what the answer is to that question. So maybe Rob, I'll put it back to you to lead us through our celebrations portion of the agenda.
Thanks, Aaron. And yeah, I think, you know, at some point you may actually get a live question. So I'll be fascinated to see your response when that actually happens. So I just encourage, you know, folks, we are trying to, it's important to me that we're creating an atmosphere at Hamilton Health Sciences where everybody feels valued and respected. One of the ways we can really do that is by recognizing the good work and other things that people do as part of this team and calling it out in front of a group. We had one from Monica already, who says a shout out to all those employees who are still working from home. We recognize that it is challenging to be isolated and not to be able to connect with colleagues in person. Thank you for keeping on. That's great. I'll just reiterate my earlier shout out to everybody who was working on the alternate health facility. I know there's lots of different people involved, but Wes Stephen and Sharon Pearson and many people from their teams have been making that a reality. Really important work for our community, so that's great. Are there other shout outs or celebrations that anybody would like to mention? Bruce.
Thanks, Rob. Certainly, we're approaching back to school, as we talked about earlier, so certainly want to give a huge shout out to so many folks who've been working on trying to prepare the community and our local schools, and of course us as parents and as families to have as successful as possible a school opening. And the list is really, really long. Members of the communications team, the health, safety, and wellness team, team at the Children's Hospital, but want to give a really, really special thank you to the infectious disease team, Dr. Sarah Kahn, Dominic Mertz, Martha Fulford. They have just been going full steam talking to anyone who will listen about why it's important to get kids back to school and how to do it in a way that is safe and really is I guess comfortable and meaningful for kids and families. So really, I think it's been a great demonstration of our leadership at HHS as looking after the health and well-being of our community.
That's great. Thanks very much, Bruce. And again, a shout out to you and to Dr. Sharma for agreeing to take on that equity, diversity, inclusion work, which is, of course, over and above all the work that you're both doing on a daily basis. But thank you for taking that on. Are there other shout outs that people...
Rob, I see Wes has got his hand up here in the panelist box. Maybe we can call on him.
Yeah, okay. Wes.
Thanks, Aaron, and thanks, Rob. Just for the record, I did have my hand up before Rob said a nice thing about me, but my shout out is to Rob. And I really think for the last 8 months, his stewardship of HHS in our community has been outstanding during a very stressful time. The pandemic has been a significant period of ambiguity and uncertainty. And decision-making has been very challenging when you're in that situation. Rob has led the organization through an IMS structure or corporate command center and has been very involved in his leadership in the regional healthcare tables. That has really been very impressive. And so on behalf of HHS and our community, I would like to shout out to Rob and thank him for the last 8 months of incredible work. So I feel bad that I didn't get it in before he said a nice thing about me, but it's true.
Well, thanks very much, Wes. That's super generous. And it's true, the last 8 months has been really trying. And because of that ambiguity, you know, lots of times you show up to meetings and you're really not sure, you know. My dad used to say the answers are in the back of the book. That's really been the case for the last 8 months. It's lots of uncertainty and doing new things, so not knowing really what the right answers were. But anyway, again, very generous, thank you. Are there others who would like to shout out and celebrate anybody that they're working with?
There is one or two in the one in the chat forum here. I don't know, we've read out. Congratulations to the radiation therapy department at JCC and the launch of the CQI and completing the training while social distancing. Not an easy thing to do. That's a big huddle when you space it all out.
For sure. And then a shout out to my fellow coworkers at Decision Support from Maria Pine. Very nice. Well, there's another shout out. Everyone who takes the time to recognize their colleagues who are dedicated to equity, diversity, and inclusion by nominating them for the Pat Mandy Inclusion Award. That's a great shout out. And so I've attended all of those celebrations since being here at Hamilton Health Sciences, and it's a very really touching ceremony and a nice time that really recognizes all the work that people do across the organization to make people feel like they belong when they show up within our doors. So yeah, really good shout out. Thanks to McMaster University staff, congenital team at Mumsy. Couldn't have done it without Vicki Allen, our admin. Wonderful. We're flying a plane and building it at the same time. Congrats to everyone. Absolutely. Very true. Okay, Aaron, maybe I'll pass it back to you. Thanks to everybody for doing that. It's always, I think, kind of a feel-good thing we can do, and it's important to recognize the efforts of people across the organization. So, Aaron, back to you.
All right, thanks Rob for leading us through that. Great celebrations. Thank you to everyone that made time to be a part of this town hall today. We'll have another one in about 2 weeks' time, and we'll advertise that. You can also look to the Daily Dispatch for all your updates. I wanted to also point out, I know we had a lot of enrollment for the Hub app throughout the course of the pandemic. Of course, you can always still subscribe to that as a nice one-stop shop to keep up to speed on what's going on across the organization. In the meantime, between now and the next town hall, if you have any questions, please send them to the HHS News inbox, and we'll make sure that we get them in the lineup. And until then, and until we see each other again around town or at our sites, please stay safe. And for those that have some time off this long weekend, enjoy, recharge, and we'll see you again soon.